take class on female pelvis. So before going to see what is female pelvis, first let's see what is the functions of pelvis. So the primary functions of the pelvic girdle is to allow movement. So what is the primary function is to allow the movement of the body, especially walking and running. So the first point is the primary functions of the pelvic girdle is to allow movement of the body, especially walking and running. The next point, it permits the person to sit and kneel. So also it permits the person to sit and kneel. Next is the woman's pelvis is adapted for childbearing, and because of its increased width and rounded brim, women are less speedy. So most of the time you have seen the women are less speedy than men's. So because of why? Because of its increased width and rounded brim. So the pelvis brim is there, that is rounded, and that is width is there, that is little increases because of what? So childbearing. This is second point. Third point. Then fourth point, the pelvis transmits the weight of the trunk to legs. So the weights because of pelvis, they will transmit our trunk weight to the legs. Next is the pelvis afford protection of pelvic organs. So also it helps to protect of pelvic organs. And next it was transmits the weight of a trunk. This is the functions of pelvis. So here some five points are there. First is functions of pelvis is the primary functions is to allow movement of walking and running. Second is to helps in to sit and kneel. Next one is it helps in childbearing. So because of its increased width and rounded, women are less speedy. Then the pelvic transmit the weight of trunk to the legs, and it protects the pelvic organs. So I hope you have understood the functions of pelvis. So next is this is the diagram, pelvic diagram, easy diagram. You can see it is a normal female pelvis. So you can also use draw this diagram for exam. Next let's see the what is the gynecoid pelvis. So the gynecoid is regarded as a true female pelvis, and because its characteristic gives rise to no difficulties in childbirth. So only one true pelvis, that is the gynecoid female pelvis. Okay, and it gives the there is no any difficulties in childbearing. The gynecoid pelvis, that is the rounded brim, and that is only the one available and acceptable pelvic that is for the childbearing. Next is knowledge of pelvic anatomy is needed for the conduct of labor. So before we are going to conduct labor, first we have to see and we should know the knowledge about the pelvic anatomy. Then only we are able to go for conduct of labor. Then next is the midwife must be competent to recognize a normal pelvis in order to be able to detect deviation from normal and refer them to the doctor. So when a midwife is there, they should be very must be competent. Okay, they should be competent to recognize a normal pelvis. If we are knowing the normal pelvis, so then only we can identify any detect deviation from the abnormal pelvis, and because of that, if any problems are there, so we can refer them for the to the doctor. This is about the gynecoid pelvis. Next is we can let's see the what are the pelvic bone. So there are 4 pelvic bone. One is 2 innominate bone. Okay, one sacrum, one coccyx. Now let's talk the pelvic bones one by one. Okay, so first bone was the innominate bone. So each innominate bone is composed of 3 parts. So there is a innominate bone consists of 3 parts, 1, 2 and 3. So first one is ilium. Okay, first one is ilium. Then is ischium, then is symphysis pubis. This is like pubic bone, symphysis pubis or pubic bone. So it is consist of 3 part. Innominate bone is consist of 3 part. The first is the ilium. Ilium is the large flat out part. It is a large flat out part, and then when the hand is placed on the hip, it rests on iliac crust, which is the upper border. So whenever it is first point is it is a large and a flat out part. Then next is whenever we place our hand, whenever we are placing our hand on our hip, when hip it is there, that place whenever you are placing your hand, you will feel that your hand is resting. That resting part is only known as iliac crust. So then that is the upper border. And at the front of the iliac crust, at the front of the iliac crust can be felt a bony prominence. Okay, that is known as the anterior superior iliac spine. So where a short distance below it is the anterior inferior iliac spine. So after that, a little short distance, there is a inferior iliac spine. There are two similar points at the other end of the iliac crust. Similar points are there too, that is the other side of the end of the iliac crust, namely the posterior superior and posterior inferior iliac spine. Okay, the concave anterior surface of the ilium is the iliac fossa. So overall this paragraph I will show you in the a list down, how it list down. So list down means how to list down. First one is it is a large flat out point, first point. Okay, then where the hand is placed, that is the iliac crust. So for second bone, it is the first bone is iliac crust, second bone is superior inferior iliac spine. Then third one is the anterior inferior iliac spine. This all you have to remember. Like it is a large flat out, and the front part is the iliac. Here iliac crust is there. The front part of the iliac crust felt the bony prominence known as superior iliac spine. Then the short distance below it is the anterior superior iliac spine. Then there are two similar point also is there, that is posterior superior iliac spine and posterior inferior iliac spine. So next is the concave anterior surface of the ilium. Also there is a concave and anterior surface of the ilium is the iliac fossa. So let's see in diagram. So I hope you will be understand easily. So this is the pelvis. So I said this is the iliac crust. This part is iliac fossa. So I hope you will. Then this is posterior superior iliac spine. Okay, then posterior inferior iliac spine, like that it is here in this diagram is there. Next is we can see about the ischium bone. First in innominate bone, first one is ilium. Now next is ischium. Ischium is the lower part. It has a large prominence known as the ischial tuberosity. Okay, on which the body rests when sitting. Behind and little above the tuberosity is an inward projection, the ischial spine. So here one thick, it is a large thick lower part. First one was flat out. It is a large thick lower part. It's a large thick lower part, and it has a large prominence known as the ischial tuberosity. Also which bone it is having, ischial tuberosity it have. Then also on which the body rests, and behind and above little tuberosity is inward projection like ischial spine. Also it have a ischial spine. Okay, then next one is the in labor the station of the head, fetal head is estimated in relation to ischial spine. Whenever we are conducting, like we are saying the labor process, that they will estimate the fetal head in station of the fetal head in relation to the ischial spine. So this is the second point. I will show you how to list down the ischium bone. So here you can see the ischium. It is consist of ischial spine, ischial tuberosity, and obturator foramen, 1/5 of the acetabulum. So this is regarding the ischium. Next is the pubic bone. The pubic bone forms anterior part. So this is from the anterior part. So it has a body and two over-like projection, the superior ramus and the inferior ramus. So superior and inferior ramus. So here this is the pubic bone. This is the pubic bone actually. So this is the two pubic bone connected with the ligament that is known as the symphysis pubis. Okay, then so here is the ramus is the inferior rama and superior rama. This is the rami part. Then it has the body like over projection, superior ramus and inferior ramus. Then the two pubic bone meet together to form the symphysis pubis. I have said you that this is the symphysis pubis. So two pubic bone, they are formed together and they are like this, they are forming together. So this is the symphysis pubis. Then next one is that the rami and the ischium is called the obturator foramen. So here this is the rami and the ischium. Rami and the ischium is they are formed together. Here this is the obturator foramen. These two holes are there present. They are known as obturator foramen. And so this is the obturator foramen. Then the innominate bone contains a deep cup of receiving, so they can receive the head of the femur. So the innominate bone also they cover the deep cup. Here the one cup is there. Now here they will receive the femur head. Then so in the diagram, let's see, this is the part, this is the sacrum. Okay, so this is the sacrum, and in the sacrum, so it is the wedge shape. So how is the shape? It is the wedge shape. Bone consists of 5 fused vertebrae. So let's see in diagram. You can see this is the wedge shape sacrum and 5 fused vertebrae. It consists of 5 fused. This is the fused vertebrae. Then next is the upper border of the first sacral vertebrae just in forward and is known as the sacral promontory. So upper border of the sacrum, I will show you in the diagram so you can easily understand. So this is the upper border of the sacrum, first bone which is projected out. Okay, this is the projected out part which is known as the sacral promontory. You can see here sacral promontory. Okay, so first bone is, then second, fourth, okay, this is fourth bone and this one is the first bone, first vertebrae. So first vertebrae, it is a projected out, that is known as the sacral promontory. So that this is the next point. So I hope you understood. Then the anterior surface of the sacrum is concave and is referred to as the hollow of the sacrum. So in diagram again, let's see. You can see the anterior this is the curved shape. Okay, this is the curved shape and this is known as the hollow of a sacrum. Next is the laterally the sacrum extend into a wings or ala. So laterally the sacrum is, this is the lateral part, that is known as the wings or sacral ala. Ala. Okay, so this is the laterally wings or ala. It is known as. Then this is all the about the sacrum, the second bone. So next is see the third bone. What is the third bone? Coccyx. Next is the coccyx. So let's see about the coccyx, which is the first. I will show you in diagram what is the coccyx. So this part is the coccyx. Okay, this is the part. This is known as the coccyx. So let's see about the coccyx. This is not much but small, little part only. So the coccyx is a vestigial tail. So you have seen that small part, that is a vestigial tail. It consists of 4 fused vertebrae and forming a small triangular bone. So you have seen this is the 3 point. Okay, vestigial tail and contains of 4 vertebrae, 4 fused vertebrae, and they are forming a small triangular bone. This is a small triangular bone. So remember, I will show you in diagram. So this is the triangular, okay, vestigial tail. This is the vestigial tail, and then it consists of 4 fused, 1 2 3 4, 1 2 3 4. This you can count. It's 4 fused vertebrae. It is the consist of 4 fused vertebrae, and also it is forming a triangular bone. So because of 4 fused, it is like a triangular bone. So this all about the pelvic bone, 2 innominate bone, 1 sacrum and 1 coccyx. So next class we will see about the pelvic joints. Thank you.